When you as a dentist open the clinic, the main motto of everyone at the clinic is to earn more money and earn more profits. However, as dentists, we tend to focus on doing more patients or doing patients wherein we forget how to make sure that the profit increases day by day. And therefore, in this video, let us discuss how to increase the profits day by day and year on year in your dental clinic. So we have 6 different points for you. Let us understand how can you focus on these 6 points and make sure the profit at the dental clinic increases every year. So the first point for you is right over here. Make sure that you focus on those patients who are paying more money to you, or focus on those services which pays you more money. So how will you understand which are these services or which are these treatments which pay you more money? So sit down, check back last 3 months of money that you have collected from your patients, understand what treatments have given you more money in the last 3 months. It could be a root canal for some it could be a smile designing, for a few it would be implant, and for the others it could be braces or a full mouth rehabilitation. It can vary from person to person, so I want you to understand which ones are the high paying services at your dental clinic. When you do that, when you understand which ones are good and which ones are paying good, I want you to focus only on those patients who are getting these treatments at your dental clinic. By doing so, what happens is you are reducing the energy or reducing the efforts and putting more focus on these patients, which will help you grow your practice. And we have seen that your practices can grow by as much as 5 times when you focus on these patients. So this is something which is called as the Parito Principle, which means that in general at your dental clinic, 80% of the money that you collect will be coming from only doing 20% of the patients, and remaining 20% of the money that you collect comes out of doing 80% of the work or 80% of the patients. So I want you to focus on those 20% of patients only, which gives you 80% of the revenue. By doing so, you'll make sure that you burn out less and you can focus on those services which gives you more money. So what do you do with those remaining 80% of the patients which is giving you just 20% of the money? I'm not telling you stop doing treatments from them. Slowly and steadily delegate that to your associates, to your assistants. Make sure you have more time so that you can focus on those patients which give you more money. The next point for you is right over here. Evaluate and eliminate dangerous customers. Yep, that's right. I'm asking you to reduce those patients which take out a lot of your time and don't give you money. So these are the ones which come to you, bargain you a lot, or at the end they don't pay you, they are defaulting on their payments, or it could be they are so demanding that it takes a lot amount of energy for you to get the treatments done, but when it comes to payment perspective, they are not so good on payments. So reduce these patients or reduce these customers who say that they bargain with you or who take a lot of your energy. So when you do that, you can easily focus on those people who are ready to pay to you and give you the money that you want. Coming to point number 3, have a budget for everything that happens at your dental clinic. It could be the materials, it could be the salaries, it could be the lab bills. Have a budget and track what are your payments that are going into these particular departments. So say for example, you are buying regularly from different vendors, so you don't have a same vendor all the time, you are buying from different vendors, and there are different materials which come to the clinic on a regular basis. I want you to sit down, understand what is the money or what is the budget that goes on these particular things. I want you to sit down, focus on where are you spending more, and is it actually necessary to spend more, because not all the time it is increase your inflow to increase the profit. Sometimes it also means reduce the outflow to increase your profits. So sit down, have a budget for all the things that you buy or that you use. Understand that is there any wastage that you are making, is something being thrown out because you bought it because you got a good rate and finally you had to throw it out because it got expired. So try to understand all these things, reduce your wastage, reduce the budget if you're shooting over the budget for some particular thing, and work on your budget so that you increase your profits. Which brings us to the fourth point, is have loyal vendor relationship. I mean, there are times I've seen dentists who call n number of vendors, who speak with so many of them. Finally, isse baat kiya, usse baat kiya, third vendor se baat kiya, what is the rate for this particular thing, and finally they understand, oh, this person is giving this product the cheapest, so today let's order it from him or her, and the next time I'm not sure whom will I buy it from, because the next time whosoever gives it the cheapest to me, I'll buy it from that particular person. And this doesn't help you to create a loyal vendor or a loyal material dealer. When you have a person from whom you are ordering regularly and consistently, you develop a strong relationship with this particular dealer, and therefore this person now knows कि come what may, this dentist is not going somewhere, I am going to get the order from this dentist month by month, and therefore he or she or the material dealer can now offer you discounts, and that is how you can increase your profits. So have a loyal material dealer, build relationships with them, and this person can help you grow. Let's understand the fifth point, which is the second last point. Try to find out patients who are either NRIs or foreigners, because what happens is these patients, they could be anywhere in Australia or New Zealand or UK or Dubai or say United States of America and Canada. So what happens is, because of the conversion rate what happens is they earn over there either in dollars or could be dirhams or could be something else, and when they come to India, because of the conversion rate, that small money, it becomes a bigger money. So what actually happens is the services or the treatments that you offer become cheaper as compared to the same treatments when they do it in their country. So try to market on finding these customers who are not belonging to India, either NRIs and foreign customers, get them to your clinic, and that's how you will increase more money and have more profits at the dental clinic. Coming to the last point, the sixth point, and a very important one, is delegate your work and find out consultants who can come to your clinic so that you reduce the burden of getting treatments of all the patients and all types of treatments. So what I'm trying to mean is, I have seen dentists who know they struggle. Say for my example, if I say me, I struggle, I'm not so good in extractions. So if I'm not so good in extraction, and if I sit taking hours doing a simple extraction, finding at the end that I get very small money and put a lot of time in doing so, rather let me not do it, let me delegate it to someone who does it consistently and who does it nicely. So I have two benefits if I delegate this thing to a consultant. The first thing is the quality of the treatment doesn't compromise. I can tell to my patients that, you know what, I am good at XYZ particular treatment, but for extractions I am not good. I know somebody who is much better than me, and let that person come and get the treatment done. At the end, the person or the patient will be satisfied because he or she is getting the same service. So that's the first benefit that you get. The second benefit is you reduce the burnout, because say if you get stuck in an extraction, because I do get stuck at times, and if I take hours at the end of getting the treatment done, I feel sweaty, I feel tired, and I don't feel like doing more patients. So rather, delegate that work to somebody else and focus on those services that you can do and you can do it well. So these are the 6 points for you. Go outside, don't just watch this video, go outside, understand all these 6 points, make down notes, work on them consistently, and do like my video and forward it to your friends.